So if you've hurt your lower back, he was a New Zealand physiotherapist, and he kind of figured out that if you do have a disc bulge, one of the ways that you can actually make it feel better is by really gently going into what they call extension. Please make sure you talk to your doctor, go to see your primary healthcare, make sure you're diagnosed correctly, make sure it's safe for you. This is more just for fun and education, but essentially the idea is that they imagine that the disc that's come out is like a little bit of a jam donut, and the jelly's come out and it's irritating on the nerve. And what this does is it kind of like makes a reverse suction, and it tries to suck the jam back in. So if this is the right one for you, and once again you've seen your healthcare professional and all that stuff, what they find is that just something as simple as standing and just gently coming backwards like this, and you think about it like a rusty gate, you're not trying to go because that can you might go too far too fast, and you might stimulate a little bit of an inflammatory reaction and make yourself feel a bit worse. So it's the repetition that gets you to feel better. So by just coming back nice and gently, by the time you get to about the 10th, you start to feel like you can go a little bit further and you don't feel as stiff. So if you're waking up in the mornings, you feel kind of hunched over, you're really stiff through there, just something as simple as this and giving yourself the time to start to move better can be really, really helpful. So that's just a great, easy, particularly if, once again, you've seen your healthcare practitioner, safe way that you can stand up at work, walk around for a little bit, get a little bit of blood flow through there, and then hopefully start to feel better. So we've got standing McKenzie's. Then we've got dead bug. Now, I've already done dead bug before, we're going to do it again.
Oh.
Not here though.
Oh, okay. Yeah.
So if you've hurt your back, one of the things that can happen is essentially like people always talk about your core shuts down, and what that means is the little muscles that are meant to hold the spine together and keep it stable, these ones deep through here, they're not firing as well as we'd like them to do. Plus your abs that are meant to kind of like work like a belt aren't quite coming on. So there's a simple exercise called a dead bug. It's called a dead bug because you look like a dead bug, that can help them start to activate. So if you go back a little bit, Christine, the idea is I'm like this. So if I have hurt my back, I'm in a nice neutral spine. I'm not hurting it. Obviously, if it is sore, stop, because you're meant to feel better. If you feel worse after, either you're not quite doing it right or it's not quite the wrong one for you, please check with your healthcare practitioner. But essentially, I push my spine towards the ground, just gently. And by doing that, it makes my abs start to fire. Plus, it makes those little muscles start to work. And then what we're trying to do, sometimes it helps to put your hand on it, is just to very slowly lift that leg up while keeping your spine in that nice neutral position. So if your core isn't active, what will happen is you'll lift your leg and your spine will come up like that. And what that means is if you do have any soreness or inflammation, it's just kind of like jolting it a little bit. So you're retraining those muscles to work, so that when you're walking around or moving, they're kind of keeping you nice and strong. So you push down, feel that there, and then you really slowly lift that leg up, really focusing on your spine not moving, and then you're going to move to the other. Now when you transition, that's typically when people go like that. So you want to really slow it down, making sure that your spine doesn't move and your abs are working. At some point you're going to have to breathe. And this is really good because if I have to relax to breathe, that means that every time that I have to breathe when I'm walking around, I'm not having those muscles be able to help stabilize my spine. So you're moving and then you're slowly breathing in, but while making sure that your abs are still on and you're protecting your spine really slowly. Once you get more advanced, that's when it turns into the dead bug. So see, if I lift both my legs up, if I don't keep my core active, it comes up like this. So it makes that weight harder. And then I'm adding my arms up like this. So it's making your body kind of have this nice muscle activation and stabilization down the whole spine. And you're just gonna do the same thing. So I'm making sure that I breathe, and it's a slow movement. We're trying to focus on this not moving. You can do it fast, in which case like your spine moves, but if you're trying to help develop stability through the spine, nice and slowly, And you can do it in any variation that you really like, but nice and slowly, making sure that you can keep that spine stable and you can talk and breathe and get that better. So in the morning when you wake up, you can do this before you even get out of bed. It'll help those muscles wake up and fire, so that when you do start walking around, it's helping hold your spine together, helping reduce your pain. The other thing that happens is, if these muscles aren't firing properly, your hip flexors and your glutes will go really tight to try and protect your spine. So by doing this before you do any stretching through that area, those muscles will naturally start to relax and you can feel better straight away.
I mean, because you're doing a lot of activities.
Oh yeah, I'll relax later. So, I really, if your glutes are really tight and you can't quite get it with pigeon's a little bit too intense. Or you've hurt your lower back and you're trying to be really careful of your lower back. A great place to start is called a figure four stretch. So you start on your back. You can do it before you even get out of bed. A lot of people do. All you do, put one leg like that. Now if this is really tight, that might be more than enough for you to start to feel the stretch. If it's not, then if you can, you bring your hands, holding back through there, and see how I can hold that really comfortably. My back's, there's no flexion through my back, so there's no risk of hurting my back if I've got like a little bit of a back injury, but my glutes are tight. And then to make that stretch stronger, all I need to do is pull my knee to my chest, and I can already feel that stretch go quite nicely. Now, if my back's sore and I can feel my hip coming up like that, maybe I don't want to do that just yet, depending on how you're progressing. Or you want to get an even deeper stretch because you can't bring your knee quite closer, then you can switch and you can grab your leg like this. Like some of the people that we treat that are pregnant, like obviously, or you like me, you got a bit of a beer gut, your belly can get in the way, so you can't really use your knee. So you can release that, hold, and then you can just bring your leg as nice and far as you can, all the way like that. So the advantage of this is because there's different fibers where you want to find the stretch. So let's say that fiber is a bit that I want to stretch, or I want to move more through there. And I can do that really easy. Hold that for 30 to 90 seconds. Big breath in and then out. And you should be able to get even deeper. So we've got dead bug to kind of help activate things, and then if you're moving on and trying to progress, the next little thing you're trying to do to help keep your spine stable while moving is called a bird dog. I'm not sure why, maybe because you look like a bird dog, but essentially you're on all fours, and it's the same principle. You're trying to focus on keeping your spine stable, so you're not trying to let your body kind of move. So you start nice and simply, just start with your leg to start with, and you're lifting that up like that, and I'm being slow and deliberate because my abs need to be working and my spine needs to be working. Otherwise, if I do it quick, my back will bend. So you're focusing on just trying to keep that stable and relearning that idea. So you start like that, same idea. In the transition, you might be tempted to kind of like lose control. So you're really focusing on your spine, being nice and slow, going as far as you feel comfortable. If you can hold stability to here, that's all you need to do. Over time, you'll build that up. Let me go a little bit further, that's cool. And then you do that till you feel comfortable and strong. And then to progress that, so it also takes care of the thoracic, is you like this, and then you're going to do opposite hand, opposite leg. Once again, it's about stability in the spine. I'm not trying to be fast, but I'm trying to keep my spine nice and stable and not move or cause me any pain when I'm going through things. And what that does is mean that every time you're walking around, you're going to feel much better. Every time you go to take a step, you're not going to lose stability in your spine. If you do that for a minute or two, you're also learning how to keep your abs and your core active as you're breathing, and it'll just help you feel better. But slow it down. Obviously seek professional help to make sure it's appropriate for you, and if you do have any back pain or anything like that, make sure you see your doctor. This is the Mackenzie kind of stretch. Once again, I'm pretty sure he's like a Kiwi physio. The story goes that somebody came in that had like crippling back pain, and he told him to go lay down on the bed, and you imagine they're going to lie like face up, but instead he's come in and they'll face down, but the bed was one of those adjustable ones, so essentially he's laid face down and he's bent backwards like a banana, And the guys turned around and said, I don't know how this has worked, but I feel heaps better. So it actually made me start to think about back pain and how you could potentially use different movements. So obviously check to make sure this is appropriate for you. But let's say that you have a little bit of back pain or tension. The way that they talk about it is you find something nice and stable, so it's not moving too much. And if you can, you're just going to lie like that. And then start to come up. The idea is that you want to be relaxed with the movement. You're not trying to tense and make it worse. You're trying to be nice and gentle and just add a little bit of movement and flexion into the spine, and then breathe nice and slowly. Let that kind of relax into that situation. With any rehab stuff, you're meant to feel better after. So if you start to feel worse or you feel worse after it, it may not be the right one for you. So make sure you check in with your healthcare professional. But over time, the idea is that you're going to start to feel stronger and better, and you can start to do these kind of things like that. And you're focusing on letting your back stay relaxed and getting that nice kind of rounding through there. And the idea is they imagine that it helps that if you do have a protruding disc, kind of go back into place by making a reverse kind of vacuum through there. If it is the right one for you, by the time you've done a few, you should be starting to feel like a reversal of some of those symptoms. So look after yourself, don't do anything that hurts you, always work with pain-free range of motion. Doing this and going into that pain is not what they're trying to get you to do. You're trying to go to where you feel it, and then over time and repetition, get more and more. So if you're looking to improve the stability in your core, obviously the classics are your plank. So plank is pretty simple. But let's say that you've had a sore back, or you've been injured, or you're just trying to get some strength back. You want to start nice and simple. So at the moment, I'm just let my body relax and slink onto that. All I'm going to do is I'm going to lift myself up. I'm going to hold onto my knees. So that's a lot easier than, see how I'm kind of like just tensing my abs. Been doing these all day, so essentially my abs are kind of shaky at the moment. And if you can, hold for like 30 to 90 seconds. You can go longer if you want. And if you want to hold long enough that you have to be able to breathe. And that way you're learning how to hold tension in those muscles while breathing and talking. Once that's easy enough, then you can go into your full plank. And that's just coming to a push-up position. Now, what you don't want to do is this, because that's just going to add pressure through your joints of your spine. You want to bring it to 90, have that feel good. If this is a little bit too challenging, you can make it a bit easier by bringing your bum up. But if you can, you want to get it to about 90 and just hold 30 to 90 seconds at a time. You can always go a little bit more if you want, but at least long enough where you have to learn how to breathe while keeping those abs tense. So the side plank is called the side plank because it's plank for your side. So the idea is you're learning how to tense these muscles through here to try and get them to be a little bit stronger. So at the moment I'm just relaxed and letting my body kind of sink. But to start with, I'm going to be nice to myself. All I'm going to do is on my knees, I should feel that come through nice and tight through there. You want to hold for long enough where you have to breathe. The reason for that is you want to learn how to keep these tight while breathing. Once you feel really good and confident for that, you want to hold for 30 to 90 seconds and then build up longer if you can. To make it stronger, all you need to do is come like this. So let's say I'm a medium setting. That might be enough, but let's say I'm going to advanced. Have my legs straight, and that's making more of a leverage through there, really making sure it works through there. It's also good for helping your shoulder get stability. Work with it, please don't hurt yourself. Hold it for 30 to 90 seconds, and obviously doing both sides. So you've injured your knee, or you just wanted to get some strength back and some flexibility into your hip flexors and your glutes. A really good place to start is what's called an ATG split squat, made famous by the kind of knees over toes guy on social media. Thank you very much. And it's good because you can do it find something stable like some stairs. Rail would be great. And let's say you start with your injured leg, you put that up like that, holding on. All I'm doing is just going to pain-free range of motion. So that will help me use my quad, get some strength and some range of motion, and I'm being real safe. Like, I've got this, I've got it really controlled. But if you have a look at this leg, that is also making my hip flexor stretch, my slower stretch under load. So it's strengthening and lengthening that. Plus, if you have a look on this leg, I'm getting to use my glute. So it's really good. You get pain, controlled and stable pain-free range of motion. So you're getting all the fluid out of your knee, you're strengthening your quads, you're reactivating your glutes, and you're stretching and loading your psoas. And it's, as you get more confident with that, you can make it harder by just simply going down a step. The idea is you get better and better at going into those positions. So you start holding, you want to aim for 5 sets of 5, obviously both legs, but start really slow, start up nice and high, and walk your way down. And the goal, I'm not good enough room anymore, but the goal is to be able to come all the way down and then all the way up in those 5 sets of 5s. Then you can start adding some weight to that if you'd like. But by doing this, I'm really helping open that up. I'm helping get fluid out of there. I'm strengthening the tissue, and I'm also developing control and balance. So it's really safe and easy. If you've got a sore back, you've injured your knee, you've injured your hip or even your ankles, it's really good. Works most of the lower body, and you can progress it really safely and easily. So the hip is really kind of complicated, and you want to think about it similar to how people talk about their shoulder. So there's little muscles in the back called your deep rotators that essentially hold your femur, big bone through here, help hold it in the socket. And if they're not working properly, what happens is some bigger muscles, like your hip flexors through here, they can go really tight to try and protect your hip in space. Now, if you do injure yourself, or you've hurt your glute, or you sit a lot, sometimes it's because of how we live, they can kind of shut down a bit, and then we get really tight through here. So a really simple exercise to start to make these work better is basically just doing some external rotations with the hips. So I'm sitting here with my feet like that. I can use both at the same time. So if, for example, I'm pregnant and I've got pelvic girdle pain, I'm loading both sides nice and equally. And what it does, by going out, I'm forcing those muscles to work, and I'm trying to do it nice and slow and controlled. If you watch my feet now, Christine, so I've just done like 2, and I'm moving into my 4th one. See, I can actually move a lot further. And that's because those muscles are firing better, which is allowing the muscles in the front to relax. So I'm actually getting more internal rotation of my hips, which is like really cool. So it's a nice simple one you can do that you can use to activate your glutes, and it should help muscles in the front chill out and relax to reduce any kind of like hip and groin pain.
Cool.
So this next exercise is, you've been getting stronger. Let's say you've hurt your ankle or your knee or your back sore, you get really tight in your hips. You're starting to get stronger. You've been doing your flexibility stuff. You're doing good, but you're looking to see if you can add a little bit more resistance to really make that work. It's called Superman for kind of obvious reasons, but hands on the wall. You want to have your leg around about 90. You don't want to be like this because that just won't make it be too hard and won't really work. And then you pull your leg up like that. So actually, I'll start like this so you can see me. I'm looking forward, and then I'm opening up my hip like that. So it's making these muscles here, my external rotators, work really well. But then, so that's external rotation. And then if I really slowly, I'm not trying to do it quick because I'm trying to make every fibre of those muscles work. I can come down into nice internal rotation of the hip. And that'll help your psoas relax, your hip flexors relax. Yeah, my leg just popped. Makes those work really good. Now, if you come back over here, Christine. So, let's say that that's really easy. I can make it harder. Take my hand away. So what that means is I've got to use more. If you even just look at my foot, as soon as I take my hand away, I have to use more stabilizers in my ankle, make my knee nice and sturdy, and I have to work this hip harder. So just by taking that one hand away and making sure I move slowly, I'm really going to make my glutes work, improve my internal and external rotation. Helps protect the knee, will help the psoas relax, that muscle that comes through here, and helps take pressure off the lower back. So if you do lots of sitting, lots of driving, doing that in the morning or in the evening to help yourself wind down, get some blood flow back through there, help everything fire properly and protect all your lower limb. So if you've already done your seated external rotators, then you can move to what people call like 90-90s. The purpose with this one is to get internal and external motion through the hip, helps these ones activate, and it will really help the muscles that are not meant to be designed to hold on to things to actually start to relax. So if you sit a lot at work and you get really tight at the front of your hips or really tight in your lower back, this will actually help these muscles fire, help these muscles relax, also start to get some nice blood flow, so you can do it in the morning so you don't fatigue as quick when you're sitting, or when you get home, if you do this, you should actually start to feel your back relax really well, because the big muscle here, which always comes from the inside of the hip, the femur here, comes up the inside of the spine, and it's about the size of my forearm, so when it gets tight, it really pulls through here and forces these muscles to get tight. So it's really simple. They call it 90-90 because you're meant to have your legs at 90, and then you're just moving like through there. If that's really hard, you can make it easier for yourself by making your legs straighter. Put your hand on the ground, help yourself through. And that's going to help all that kind of movement through there. So starting like that, and then let's say you start to warm up a little bit, you bring your feet closer, you bring your hands up, then let's say you're at a jiu-jitsu class, then you kind of add that into there. So you're really working on those rotations. But nice and simple. That's a really nice way to relax at the end of the day. Even if you're just sitting in front of the telly, that is going to help this activate, help this calm down, get some nice blood flow into your hip itself, so if you have any arthritis or anything like that in there, it's really, really nice. Helps the lower back relax as well.
Okay.
So if you've got hip and groin pain, you want to actually start to get some range of motion under some load. So if you've already done your 90-90, so you're not putting too much load through there, and you've done your Superman kind of internal, external rotation, the next one that you can do for yourself is leg out like that. So I'm trying to keep my hips in line with my knee, and then all I'm doing is I'm coming down like that, and that's really opening up through there, plus stretching through there. I'm just going to do both sides, nice and slowly, and that's really going to work my abductors, help the hip open up, also help working my hammies, my quads and my knee, range of motion from my ankle. But I want to be careful I'm not doing this. If I lean like that, it takes the pressure off there, and it takes the pressure off there. Whereas if I stay flat, I'm looking at the wall, it really is a nice opening and stretch, a nice lengthening. Obviously don't hurt yourself, so if that's as far as you can go with pain-free range of motion, perfect. But as you do more, you want to be starting to open that up. Then obviously, if you can, do both sides. So if you're starting to stretch your hamstrings, there's a couple of really simple ways that you can do it. The first one is called a baby elephant march, because apparently that's how baby elephants march. And you just find a chair, or if that's too low, like a little bit of a table or a bench. I'll start with the chair. Have your feet, and then all I'm doing is just by straightening this knee, I'm putting a nice little stretch through my hamstring there. Let me come from behind, left side, Christine. That makes a nice little stretch through there. And then by switching from one to the other, I'm able to get a little bit of a stretch through. Once I'm comfortable with that, I can work my way further and further down. And you're just trying to hold just for a little bit, 30 to 90 seconds. And over time, that'll open that right up for you. So start nice and easy. Once again, if you have an injury or you're just starting to get into things, finding something you've got support on and just working your way through nice and gently. Absolutely perfect. There's like almost no chance of injury if you're taking your time and you're supporting your body weight, and then you can progress it nicely so you can get all the way down to touch your toes. So the pigeon stretch is a really good stretch. They do it a lot in yoga, and depending on where you actually put your back, it'll change the stretch to be in different areas. So I have my leg, if I can, I want to get it as close to 90, but that can put a bit of pressure through the knee. So to take the pressure off that, you can bring it a little bit closer. And then my back leg goes back, and then I'm just gonna roll so my foot's down. So see how my foot's down like that. So what that does is it stretches out my glutes here. And if I want to make that glute stretch more, I can either bring my knee more to 90, sorry, just like that. Once again, if you've got a sore knee, you don't need to do it. Or I can walk my hands forward and lay down flat like that. And that's really stretching all the way through there. Hold for 30 to 90 seconds and do, up to 5 minutes. Try and make at least 5 minutes a week and you should start to see some improvements. But let's say I've got a tight hip flexor. I can then walk my hands up like this. And if you have a look, that's getting a nice stretch through my hip flexors through there. I might need to shuffle my weight around and change how I'm kind of sitting. Just to kind of get the right part that I want to relax. But once again, hold for 30 to 90 seconds and should feel pretty good. So couch stretches, you imagine there's a couch there. I don't have a couch, but I've got a wall. You can just put some bracing or some pit cushions there to make it easier. And essentially, this leg goes up like that. This leg goes forward. And then by coming back, I'm stretching my hip flexor, but I've got tension all the way through the fascia from my foot, through my shin, through the front, and then coming up into my hip flexor. And then I'm trying to get my body back as close as I can to the wall or the couch. And if I want to make it even more, I can open up through here, and that's going to actually start to stretch out the fascia that goes through my diaphragm, through my chest. Really work all of that. If you're feeling really good with that, the more advanced version, you'll see it kind of like more martial arts classes or even yoga. They do it a fair bit. You start seated like that, so that's already stretching through here. And then the idea is you're able to come back. You might be able to, once again, if you've got a couch you can lean on. If you can make it to your elbows, that's really good. And then hold that. That'll open up the hip flexors and the fascia. But the goal is to be able to get all the way up and down like this. So that's stretching the fascia all the way in the muscles through the front of the shins, helping my ankles, helping my knee, helping all of my quads, into my hip flexors, coming through the fascia into the diaphragm, then over my neck, into my arms. If you can, hold for 30 to 90 seconds and come back. But just work into it. So this might be more than enough stretch, but if you build that up over the weeks, you better get lower and lower. So this next one's called frog stretch because you look like a frog. But essentially, it's to help your abductors and also start to open up all the kind of nice bits for your hip. If you're on your elbows, you can support yourself. It also helps your shoulders as well. So basically, you're a frog. Now, the idea is you find the tight spot and you hold it, but you can also, if you gently go through the range of motion, you'll work through all of the muscles, all the abductors that are going into the hip. You're getting a nice stretch and opening up the hips, like that. And if you want to get really fancy, the people will come forward like this, they'll lift their leg, and that'll work your rotators of your hips. Nice internal rotation of the femur. And then if you find a bit that's sore or tight, just sit there and hold it. Once again, at 30 to 90 seconds, you should start to feel that release, and you can kind of keep moving forward. Try and aim for about 5 minutes a week, obviously a little bit more if you can, but you should start to see some changes with just that. So my adductors are actually pretty flexible, but the abductor stretch is a pretty common one you used to do when you're kind of kids. You sit with your feet like that, and then the idea is you let them fold down. If you want to get more of a stretch, you bring your legs in like that, and then you can even add a little bit of a weight forward. Some people will talk about adding a little bit of pressure down with the hand or putting a little bit of a weight, so you're kind of getting into that stretch. But you can hold like this, 30 to 90 seconds, release, and then push down again, and you should feel deeper with each one. As always, if you can aim for at least 5 minutes a week accumulated, you should start to feel that really open up really nicely. So it's really good if you've got some groin pain or like some hip pain that's coming through there, because it'll open up the capsule for you and have you feel better. So if you have injured your knee or you've got poor range of motion in your knee from swelling, one of the things that can be really good is to try and get a little bit more of a stretch through there so you can return your range of motion. So last time I injured my knee, I couldn't even really do that. But the idea is, if you can, once again, don't hurt yourself and always seek professional advice before you do anything. But the idea is you want to be able to come back and sit on your knees nice and comfortably, because then you've got full range of motion in your knee and you're starting to give the connective tissue a chance to try and strengthen. But if you can't get to that and you're trying to work your way into it, once you've gone through all the other steps to there, you can start with a pillow and try and put it right up here. And then you can just sit back to a level that you're kind of comfortable. And then just by holding 30 to 90 seconds, trying to add up to at least 5 minutes a week, preferably a little bit more, that'll give the tissue a chance to kind of stretch and grow and then lay down more connective tissue so that it's kind of stronger in the future. Once the pillow feels comfortable, you might need to start with 2 or 3 pillows. Then you can move to a rolled up towel. And the same idea, if you put it in the crook of your knee, it'll actually help those muscles behind the knee relax a little bit and allow you to come down a little bit deeper. Obviously, don't cut off the blood supply to your legs or anything like that. And always work within your limits. You want to be working on pain-free range of motion, giving your body enough time to kind of lay down new tissue and strengthen. And once that's better, coming back to here. So I've had kind of a bunch of knee injuries, but whenever I step wrong and it gets flared a little bit and it swells a little bit, I find that I won't be able to get as deep, but I find that by just sitting and holding, I'm able to eventually start to work a little bit deeper. That helps with some of the inflammation in the knee, provided I'm being gentle and I'm not hurting myself. And I end up feeling like freer, better range of motion and less pain. So this next one, when it was taught to me, they just taught it to me under the name the world's greatest stretch. I really like doing it. I do it pretty much every day in the morning because there's not much it doesn't do if you take your time. Obviously, make sure you're not injured. And if you are injured and you're trying to work your way back, take it nice and slowly. So you start standing and you just gently and slowly start to round your spine coming down like that. So that's opening up all the different parts of your spine. And then I start to come down, I'm getting my hammies, and then I put my hands on the ground. So as soon as my hands go on the ground, I'm actually starting to utilize my shoulders and I'm putting my shoulder blade down. So I'm actually activating my shoulder stability, and then I'm purposely slowly walking forward. By doing that, I'm starting to get like some good movement and support in my shoulders. So you're setting up your shoulders for the best part of the day, and you can come to 90 and you hold a plank. So that's working on all of your stability for your lower back. It's starting to get through the hips. If you don't have a back injury and you're feeling pretty good, just by coming back like this into Cobra, you're kind of opening up all those extensors. Feels pretty good. And then coming back, and then this comes forward. So now I'm starting to stretch my quad. I'm starting to stretch into my psoas, and I'm also getting aspects of my hammies and abductor like this. And then I'm going to make it even better by, once again, if I keep this shoulder stable, I'm working on my rotator cuff, my serratus anterior, my shoulder stabilizers. I can look up like this, and now I'm getting a stretch all the way through my diaphragm, and I'm starting to get some movement into my thoracic, so if you get pain between your shoulder blades. So if you look up, that makes it even better. And then I thread the needle. So I come through under like that, and that opens up all those muscles through there. You can feel it through your lat, feel it through your diaphragm. Just gets the spine going, 5 to 10 times, and then I'm going to come back. So once again, I'm doing it slowly and deliberately. I might get to here, if I just go into a bit more of a downward dog and do a little bit of a baby elephant walk. I'm going through my hammies, and I'm also going through my calves. Then I'll come all the way back, and I'm slowly going to go through the spine, and then if I really want to, just a little bit of rotation. So we're doing that. You've stretched the hammies, you've stretched the calves, you've got extension, spinal flexion, you've got the shoulders start to stabilize, you've worked the rotator cuff as you're moving through there, you've stretched the diaphragm, you've stretched the psoas, and you're starting to get some good thoracic movement. And because you're flanking, working your stabilizers and also getting your neck strength a little bit stronger. So it does like heaps, and if you just do that 3 or 4 times, you've done most things and you'll feel pretty good. Quadratus lumborum is a muscle called the QL. It's in your back here. A lot of people get really kind of tense and tight through there, particularly if they're doing lots of sitting or lots of driving. Obviously you need to make sure that you check with your healthcare professional, I'm going to say acupuncturist, and make sure you're releasing through your hips and your back and make sure it's appropriate for you. But if you are feeling really tight through there, there's a really easy stretch that you can do that is a little bit counterintuitive. All you need is something to hang on to. Please don't fall over. So you hang on to something, and then you're going to cross that leg over. So what that does is it makes a line of tension, and then I hold, and then I'm just going to lean. And what that does is it opens up that muscle through there. It's a nice stretch. All you need to do is hold for 30 to 90 seconds. Do that 5 times a week, and you should start to feel better. As it starts to relax, you should better go nice and deep. So eventually, you get a nice, strong stretch through there. So if you've hurt your lower back, there's some really good acupressure points you can do to help reduce the pain. The classic one for pain throughout the whole body is large intestine 4. So in Chinese medicine, the body's interconnected. So by helping one part relax, we should get some others. So traditionally, we don't use this point if we're pregnant. So if you're pregnant, please don't use it. And always check with a healthcare professional, make sure it's appropriate for you, but just for fun, you can get in there and you can massage that spot through here. In Chinese medicine, we talk about this point all the way through here being quite linked to the front of the hip. So by getting in there and massaging in between those bones, particularly if you find a little tight spot, hold it, you should feel it release. You're trying to send a signal for the front of your hip to release, and then you want to balance that out with the side part, your TFL and things, going all the way through there. And then these little joints through here, that's meant to represent like your glutes. This bone that comes along through here in Chinese medicine, is sometimes used to represent the spine. So if you have had a sore back, starting from there and kind of massaging along that bone, you'll typically find a tender spot. If you massage through there, you should start to feel a little bit of a pain relief for your lower back. You might need to go a little higher, and obviously don't hurt yourself, but hold for 30 to 90 seconds and then moving all the way through there like that. Some other great points that you can use to help your lower back, and typically we always massage on the opposite side of the body to where the side of pain is, but do both. Is these acupressure points through here on the foot. I've been on the carpet, so my foot looks a bit funny, but coming from this bone, in between that gap, you'll find a nice tight spot in there. This point is actually called lying down to weep. And what it does is it kind of helps your glutes relax, helps the muscles in general relax, and it can be really helpful, particularly if you've got some pain going down your leg or your glutes are really tight. So if you've got some inflammation in your lower back, or what we would call heat, there's massaging through the inner part of the foot. There's a nice spot called kidney 2 just about here. And what it does is it helps the joints kind of relax, help get what we would call heat out, and help release some pain. So by massaging through there, you're going to hopefully start to feel some relief in your back. And it's a really great thing to do because it's nowhere near your back, so there's no risk of injuring it. And if it helps you feel better, that's fantastic. The other classic points is basically they're all along the tricep down this line through here. So if your back's really tight, one of the things that Chinese medicine will do to help is actually get your tricep to release. And the easiest way to do it is just to kind of self-massage all the way through there. And as you do that, you should feel the little intricate muscles that go from one vertebra to the other start to release and let go. If you find a sore bit, you can just hold it 30 to 90 seconds. Obviously don't hurt yourself, and you should start to feel better in your back.